We're here for the second exercise. This is the wall tap. Before we get into that, let's talk a little bit more about what pelvic internal rotation is. And to really understand that, I'm going to get my models out again. So this is one half of a pelvis, one pelvis bone. This is your sacrum bone. And so if I bring this in, so imagine I'm standing here, I'm going to tilt my body towards you. This is what the pelvis looks like. And the pelvic neutral is probably about right like that. External rotation, if this is the front left pelvis bone, external rotation is an opening and a enlargement of that inner angle right here between the sacrum and the pelvis. That's external rotation. Internal rotation is a relative decrease of that inside angle. And so it's important to understand that. And again, internal and external rotation, generally important to make sure that our leg is aligned in neutral, but there are subtle movements of this external and internal when it comes to running gait. Not super important to understand, but external goes with the flexion pattern, internal rotation goes with the extension pattern. And so if we want to use our hips really well, we want to promote that internal rotation of the pelvis. And so how we do that is we have to load it in such a way where we make that angle small. And to make that angle small is to, when we do a single leg hip exercises, we really only load that stance side. And so to help demonstrate what we're going to do, we're going to use this foam roller to show you the plane of my pelvis when I'm doing this exercise. By and large, when we are running, we want the plane of the pelvis to be straight ahead, right? And so again, we talked about the idea of we don't want two pelvis bones that are angled in one direction, and that can happen if the entire pelvis, for example, is in a rotation. And so we want to promote that pelvis, if I'm holding the entire thing in my hands, to be straight ahead. This roller will demonstrate or just identify that right now I'm straight ahead. Right now in this position, I'm straight ahead. But if I twist it a little bit, you can now see that that roll is pointing, or I'm more anterior on the left, more anterior on the right. When we do the wall tap exercise, the reason we're using the wall is on the stance leg that I'm working, I only want to touch that cheek to the wall. And so if I use this, for example, but I'm not loading into that hip and pelvic internal rotation, what might happen is if I go into a squat or a single leg movement, I may go back, but I might cheat and rotate out of it. Well, I'm on my left leg right now. I want my left hip to do the work. But a cheat that the body will do is it'll rotate away from the work. We want to rotate towards the work. And so for the wall tap exercise, I'm going to show you my left hip. I want to use that hip, but I want to stretch the components of the hip, but also that pelvic joint right here. I want to stretch that open. And to do so, I want to only touch that part of my pelvis, that left side on the wall. And so what I do, you can't quite see my feet, but I'm going to be about a foot's length away from the wall. That seems to be an intermediate place to be able to do a single leg hip hinge exercise with some moderate challenge. And so I'm about a foot away. I'm going to take and I'm going to elevate my opposite leg. So I'm standing on just my left leg, and then I'm going to hip hinge and I'm going to tap only the left cheek. And that's difficult for you guys at home to see that, but I'm going to show you what happens on my right. So that's my left leg. I tap. My right leg is actually actively trying to reach away from the wall, and then I come back up. So now if I do it on my right side, you may be able to see, here's me doing a good job. I'm going to really get only the left cheek onto the, or this, in this case, my right, only my right cheek onto the wall. So I tap only the right. You can see there's a little space here with my left glute my left pelvis. If I don't do a good job of loading the posterior right hip, you'll see me fall away. Now my left is touching. You can't see my right at all. I'm not loading my hip joint, my glute, or opening my pelvis when that happens. So again, if I show you with the roll is showing that I am straight ahead, if not even reaching away, so that only my my right cheek touches when I'm on my right leg. See, there's this space between my left cheek and the wall, right cheek only touching. That's gonna put me into relative internal rotation. So now showing you on my right leg, you can see I am rotating to get that right cheek back. Femur bone rotates in, but pelvis bone rotates in too. And so when I do that, here it is showing you on the back side here, you'll see leg goes in, left side of my pelvis goes away to open this and to load the hip, but open that joint between the pelvis and the sacrum. That's internal rotation of both the femur in this case, but also the pelvis. So that's my rear view if I'm not using a wall. And this exercise can be done without a wall, but the wall is very useful for proprioception, to tap without touching the floating or swing leg side. So try that wall tap exercise, not only for great glute engagement, but to reinforce hip and pelvic internal rotation.